Stubborn belly fat. Stubborn belly fat. This is so common for PCOS women, especially those who are already at normal body weight. But even those who are not at normal body weight, their full focus would be on that stubborn belly fat, the tires, the paunch, I don't know, that's what we used to call it, paunch. And like you might have people in your family who have a bigger belly fat, but still your brain would focus only on yours, right? So let's talk about stubborn belly fat and how to deal with it. What is stubborn belly fat, first of all? But even before we dwell into that, I want to highlight one thing. Check first, are you confusing it with a body image issue, right? Like are there like emotional parts in you who are like telling you that something is wrong with you because you have that belly fat? You need to check that because like no matter, even if you clean that up, right? Like if you get rid of that belly fat, but if there is that narrative which is going on, you're actually not good, everyone else is better. If that narrative is going on, even if you lose weight, that will just keep finding other flaws in you. So that needs to be checked 100%, right? So get your reasons cleaned up around that belly fat. So many people don't even bother losing weight once they realize that they're actually good and they fully embody their body the way it is. Like they just stop shaming themselves. That option is possible even for you. Like you might not have to lose that belly fat. If you just like clean that up, that there is actually nothing wrong with me, but that you are fine. I mean, what you're good at and what's your worth, and like you believe in your core that you're actually good, and you still want to get rid of that belly fat. Then let's talk business, right? Like, okay, what are we talking about? Because now there are two things here. One, are you overweight? If you're overweight, you need to lose that excess weight, right? If your BMI more than 25 for your height, this is like a rough calculation. If your BMI is more than 25, yeah, there is like, it's not just about belly fat. It's like about the subcutaneous fat everywhere, which needs to be taken care of. And suppose you are underweight, like a lean PCOS, but you still have that belly fat, then it might be the visceral fat. So there are two types of fats. One is the subcutaneous fat, which is under your skin, and then there is the visceral fat, which is around your organs. So as a OBGYN surgeon, I have done thousands and thousands of cesarean sections, and I've done thousands and thousands of cesarean sections around women of all sizes, including the ones who are like very skinny, underweight, and the ones who are morbidly obese. So I have gone through a lot of fat layer. And I've seen a lot of belly fat, right? So there is a lot of subcutaneous fat. So anyone who has BMI more than 25, we have seen that belly fat, right? That subcutaneous fat which we had to go through. There were very few patients in today's day and age who had very less subcutaneous fat. They were either underweight, or they were normal weight, or they were athletic. So most people have a thicker belly fat. There will be some fat in front of your rectus muscles. So if you are seeing something, it might just be that. Apart from that, if you have had babies in the past, you just like might not have a good abdominal tone, because having a baby or just being overweight in the past is going to, 1 minute, I'll be in the call, 1 minute. Later. You earn it now. Sorry about that. So everyone is going to have that sort of belly fat, but if you're someone who was overweight in the past, or you had pregnancies in the past, or you had some sort of like fluid in your tummy, or you used to cough a lot, like you had asthma, you had COPD, some sort of coughing issue, your tummy is going to be like, the abdominal muscle tone is going to be not there. So the muscles and the sheet and everything is like, there's no tone. So you might have to tone that up. Surgeons can fix that for you. but I wouldn't go for surgery. Like if I wanted you to do surgeries, I would not be here talking to you. Here my agenda is specifically to help women solve their weight issues without taking medications, without doing lots of blood tests, by just correcting the lifestyle. So there are two types of fat: subcutaneous fats and visceral fat. So the visceral fat is around the organs. Subcutaneous fat is under the skin. Whatever you see, if you can hold it in between your fingers, that is probably the subcutaneous fat. Now, visceral fat means there is fat around the organs. When we open the tummy, sometimes there's a lot of omental fat which comes, like there is something called as omentum. It's like a dynamic organ which goes and sits on things which are injured. Some patients have very less omental fat and some have a lot of omental fat. So there is that more visceral fat which can happen because of excess fat on the body. There can be excess fat, like there is no fat around intestines. There is no fat around, there can be fatty liver and there can be some fat around it, but generally not much. There is fat around heart, there is fat around kidneys and near the back muscles, but in the abdominal cavity, generally there are just organs like intestines, there is a uterus, there's a bladder, then there is mainly just large and small intestines, and even the stomach and all those other organs are slightly up. But what we focus on, that lower belly where there is that fat, that area just has uterus, that area just has intestines, that area just has subcutaneous fat. There is not much belly fat in that area, like around the organs. So if you are someone with that pear-shaped body, it might just be subcutaneous fat. Now, unless you are a lean PCOS, whose BMI is like say 22 and you still have that belly fat, it might not be subcutaneous fat, it might be some sort of visceral fat, the omentum. And also the tummy can look bigger if you're bloated. Bloating means gaseous bloating. There are two types of bloating. There's one you just like swollen up, swelling all over the body, edema, and then there is that gaseous bloating where there's a lot of gas in your intestines, because your intestines are just, especially the large intestine is fixed. It's the small intestine which is very long, I think 6 meters long, I forget my anatomy. It's very long and it can fill up with gases really fast. So if you eat something which is not sitting well with you, it's producing gases like dairy, you are just going to get bloated, and the tummy is going to look big because of that bloating, because of that gaseous accumulation, and that gas can be reduced if you eliminate the food which is causing that, and also fixing your internal body system where you're not in so much inflammatory state all the time, which happens with, I'm going to talk about that. So even a lean PCOS can have excess visceral fat, but be careful, it might still be just gaseous bloating and it can be still subcutaneous fat a little bit. So how do you test for visceral fat, or like not just subcutaneous fat? Subcutaneous fat, you just have to lose weight and fat loss, and that can happen. But visceral fat, like most people worry about this visceral fat, right? Like because it's connected with like excess visceral fat means this, like it's connected to your well-being. Like you might have lots of risk and complications associated with it. So how do you test for it? Again, there are a lot of tests, labs. You can do CT scan, you can do MRI, you can do a DEXA scan, you can do ultrasound to just look at this liver if you have fatty liver. But I don't want you to just like go and do these tests, because many patients, first of all, they might not have the money to do this. Resources, insurance is not going to cover all this nonsense. Insurance will cover only things. If you're suffering, it will cover for that. Like if there is a clinical indication, they will cover for it. But if there is no clinical indication, they're not going to cover for it. They just won't. It depends on the insurance. Like some people's, like even the best insurance in this country, they have a limit, and after that they will not cover anything. But it's up to you. You can, if you want to do the test, you can go to the doctors and do it. Don't come to me. I don't do all these tests. Now, the thing that you can do at home yourself is like take a measuring tape. If you don't have one, go to IKEA, and you can get one for free. I regularly will take these paper tapes from IKEA. They are lying around free. I'll take one. And I'm just gonna do it. It's for free. Pencil and IKEA tape. So I go to IKEA checkout and just measure around the waist and hip. Now I am someone who is an advocate of weight loss with weighing scale. I don't go into inches too much, and this is like probably the first time I'm talking about inches. And the reason why I never talk about inches is because it is a very objective way of gathering data. Sorry, subjective. It can differ from patient to patient, whereas the weighing scale is like a machine which is going to give you something, right? Because we used to measure abdominal girth or abdominal circumference in post-operative patients. And what we used to do to keep it constant, because there is this gaseous bloating, we want to see if there's any internal bleeding after the surgery. So we would keep a tape under the patient's tummy and measure at the umbilicus, at the umbilical level. But sometimes it will just vary, right? Like if you're not keeping it properly in the same level, the tape can go up and down and the number will look different. And so many weight loss gyms and all will show their clients that, you know, you have made progress by just manipulating that tape. And the client says nothing. Like she's like, oh, maybe it's working. Like I had a client who came and told me that, you know, the gym people showed her picture of like how she's now fitting well in this, her shape has come. I'm like, what shape has come? If you have not lost weight, if you're not exercised, if you're, where did the shape come from? You just like, someone just fooled you. I'm sorry, but if that has happened to you, someone has probably fooled you. And I would recommend, like, if you felt something that, you know, someone is trying to fool me, please lean into that and don't go to that person again. Like maybe they were very sweet and nice to you, but if it doesn't fall into, they're not helping you, they're not helping you get what you want, don't go to them. Just don't. They are interested in just your money. So first time I'm talking about waist and hip ratio, and what you're gonna do is so what we used to do, because there was such variation, our team leader would tell us to put a marker around the patient's tummy. Like take a pen and put the tape, and like the first person who takes the measurement, because many doctors would see patients, same patient, many doctors will come and see because of different shifts and different rotations and all of that. So keep a standard, mark it on the patient's tummy, and then use only that level to measure. Unfortunately, it was not okay to mark on patient's tummy unless you are doing surgery on that. So you can't just like put things on patient's tummy. So that went out. But that's where for me it was like, you know what, I don't want to do this anymore. I never took tapes and stuff. Like clinically, I used to check. So what I used to do, what you need to do is like decide, like you don't have to mark because you will take a shower and that mark might come off, but in your brain, just some data is better than no data, right? And if you want, you can take a picture of you taking that level. You can, there are certain body markers on your chest and your tummy which can help you stabilize the level. Like there is nipples, there is like this bone, from there you can measure, and on the side. So there is like, you can find a constant way of measuring at the same level. For the waist, for the hips, they say at the biggest point. So again, there is no level, right? Like at the biggest point in the waist. So you can just take a measurement there. So generally the waist should be less than 80 centimeters, waist measurement. Whereas the waist-hip ratio, waist measurement at the umbilicus should be less than 80 centimeters, and the waist-hip ratio needs to be less than, it should be less than 0.8 or 0.85 or something. Oh shit, I forgot it. Just check Google or let me know, I will clarify that. So those are measurements. Like for me, its waist hip ratio is like 0.84, and I'm like, oh, it should be like 0.8, less than 0.8. I'm like, okay, that's interesting. That's good to know that I can work on this. So because my BMI is almost now 22, which is normal BMI, but the waist hip ratio is still not corrected. That means there is some of that belly fat, or either it's a subcutaneous fat or it is the visceral fat, whatever it is. I have an opportunity to correct that. So how can you lose the subcutaneous fat? We want some fat, right? We just want it for bodily functions. But we don't want excess visceral fat, right? And we also don't want excess body fat, like tummy fat, because you can still thrive. There are lots of people who will still thrive, but as you grow older, you are going to shrink. Like if you see most people, old people, like in the 80s, 90s, they're not very obese. They start shrinking. So they start losing weight. So you're going to shrink. So you're going to need some belly fat at some point. But if you are in your 20s, 30s, 40s, it's a good thing if you don't have that belly fat, because it's just going to get worse. So you might as well just like get into fitness right now. So number one way of doing that is basically we want to enter a state of ketosis as much as possible. Because if you have that excess, not everyone has excess body fat, right? Like I'm not going to tell like a 70 or 80-year-old who is like really normal body, I'm not going to like tell them to like lose weight, right? I'm not. But if you are in your 20s, 30s, 40s, 50s, I'm going to tell you to like, okay, correct that. If you have excess body fat on you, you have risk for Alzheimer's, you have risk for like osteoporosis, you have risk for fractures, because you know you don't have strong muscles. So we need to get you fit. And the way we enter that is through the metabolic state of ketosis. So there is a carbotosis state where we are using carbohydrates, and then there is a ketosis stage where we are using fats, our own body fat, as an energy source. So number one way of entering ketosis is by correcting your diet. Because if you are trying to lose fat, you need to burn fat. And for you to burn fat, you need to figure out a way to activate fat burning enzymes. Now, if we keep on eating carbs, the fats never get used up. So activating fat burning enzymes is just not going to happen. So first, you need to reduce the carbohydrate intake in your food. So keep all the good carbs, which are like your vegetables, whole grains, fruits, not too much fruits. One fruit a day is fine. But vegetables, we want to have foods with vitamins, minerals, fiber in it, right? So those are your fruits and vegetables and whole grains. You want to keep, if you're trying to lose weight, the protein also needs to be less, and it should be like natural proteins. Don't have like, avoid having a lot of those supplements in the beginning when you're trying to lose weight, because protein will also increase insulin, and then you will go in fat storage. Anything excess is going to go in fat storage. So in the beginning, low carbs, low proteins, and more of good fats. Once you start doing that, and if your fat component of your food is more, then the fat burning enzymes start and you can enter the state of ketosis. This needs supervision, because sometimes that keto flu is not fun at all. That transition is not good and it doesn't feel good, and that's why we avoid it so much. Like it literally feels like you're starving. But if you keep taking electrolytes, rest well, manage your mind, you will go through it. Sometimes you might fall sick, but you will get out of that sickness and you will go through it, but you have to be consistent. Most people are not consistent here because they're emotionally dependent on carbohydrates. So the moment the carb goes low, they start experiencing hypoglycemia, they start losing their shit and they can't give in, and the pattern continues. Like it just happens again and again. We don't want that kind of thing. So enter ketosis. Start having a keto diet only if you're fully emotionally ready for it. Don't enter otherwise, because if you start like being in ketosis consistently and then suddenly you start increasing your carb load because you couldn't manage your mind, that sort of sudden sugar inside of you, refined sugar especially, you might get infections. You might get yeast infection, you might get scalp infections, you might get anywhere you infect easily, you will get UTIs, you will get fungal infections in the vagina, you will get you might get viral infections. So do that very gently and under supervision. Manage your mind constantly if you're trying to enter into a keto state. Other way of entering ketosis is through exercise with a high intensity workout, like you're walking and suddenly 30 seconds you run and get your heart beating fast, again you stop, then again walk, run, again you stop. So that sort of thing is called a high intensity training workout. That can help you enter into ketosis and burn that visceral fat and also subcute fat. Like apart from that, resistance training where you're lifting muscles and the muscles are tearing, right? Like you feel the muscle pain, that means you are entering ketosis. Like that sort of training will help you enter ketosis. Walk after a meal, that will also help you. Like basically you're going to burn calories, yes, and you're also going to use your muscles. So you're going to use up that glycogen and you're going to need more energy, so you're going to go to the fats. Apart from that, you have to sleep 7 to 9 hours. This is like, I help people just with sleep for like 13-14 weeks until they figure out their sleep completely. And sometimes it might look like leaving professions, because I did that, right? Like I left my full-time hospital-based job just so I could sleep better. And it was a very good paying, safe, secure job. I left that because I wanted to sleep every night. So that is the level of commitment we are talking about here. Like, are you willing to take that plunge just for your own body? Can you be that selfish? And trust yourself. So 7 to 9 hours of sleep maybe. But you don't have to quit your job and quit your profession if that's what is happening. If you're in a day job, a 9 to 5, can you finish your work in 9 to 5 and not like stay overtime and like jeopardize your sleep? Like there's so much you can do just to improve your sleep. Lastly, stress reduction. Find ways to reduce your stress. That is integral by regulating your nervous system regularly. This is like anyone who's teaching you somatic work, yoga, or like moving your body, neck exercises, some exercise which will calm the body a little bit is going to help you. Breathing exercises. Apart from that, there is also the heat shock routine and cold shock routine, which might help you burn your visceral fat. Now that heat shock routine, cold shock routine, some heat shock routine generally in sauna experience, you will get it. And cold shock routine in that cold plunge. I don't like cold, but I can manage the heat. But you need to be very well hydrated and all of that. Like you will lose a lot of water, and if you're in ketosis, you will lose a lot of water. So a lot of hydration along with electrolytes is necessary. So how do you keep an eye on this belly fat thing? Basically progress. You have to keep a check on your progress. You can take side pictures of your tummy. Generally the subcutaneous fat is going to hang out. But more than that, the waist hip ratio, the waist circumference, that will help. And best is the pants. Like if you have any tight pants and you suddenly start fitting in them, you'll know. Or your undergarments start becoming loose and they start dropping, you'll know. But more than that, if you feel the shift in energy, like you're no longer bloated because you're eating healthy, you're no longer like low on energy because you know you're so energized because you finally got energy. Because most people who have insulin resistance, which is your pre-diabetic, PCOS, obese, overweight people, most of these people are starving of energy because that glucose is not satisfying them. Whereas fat is a system which is working from them. The moment we start burning fat, you actually feel energized because it's like, oh, I finally have energy and I don't have to feed myself for that because I always had this fat on me. And then once you have like fully achieved that state where you don't have much body fat, like tummy fat is not there, there is like you are like thinking, I think I have achieved that, then you can start recycling the fat that you store. So you might have to like do some fasting here and there once a week, and then you might want to eat low carb throughout the week. On weekends you can eat some high carbs, and then go into storage mode over the weekends, and then burn that fat what you saved over the weekends, like burn it throughout the week. That is possible. Alright, so that's it for stubborn belly fat. Now all of this can happen. You can do it on your own, provided you have access to your own wise self on a regular basis. If not, please consider getting yourself a coach. I offer these services as well. And compared to any other coach, like a nutrition coach or a fitness instructor, the kind of coaching I provide is physician led. Second of all, like I won't be a physician, but I have the physician expertise, and also mindset. Like I will catch your mindset the moment I see you drifting. The moment you start talking about like how it's not gonna work, and like all your language has changed into like I see your belief is dropping, I will catch you and I will help you like see, okay, this is where your belief is changing. Why do you think it's important to talk about that? Now, if there is something really important to talk about, like, I really don't think this is gonna work, let's talk about that. Let's find out why you think it's not gonna work. Don't just keep those loops open in your brain. Close those loops by making decisions. Because we just keep those things open and we keep on worrying and we keep on thinking this is not gonna work, not gonna work, not gonna work, not gonna work, and we're still taking action, and it just slows us down. The goal goes further away. So if you just like start tapping into like, okay, yeah, I know my brain is suggesting that this is not gonna work. Why? Because I did this, I used to do this, and I can't do this. Okay, fine. Let's find a solution for this specific problem and go back to like what is working. Yeah, it is gonna work. That sort of belief system. All right. I hope this is useful. I will see you next time. Bye.